Assalamu alaikum and a good morning to everyone.
Good
Today,
morning.
yeah,
Morning.
I, Dr. Erum Khan, is with all of you with a wonderful session, long-awaited session. We would like to welcome our honorable guest, Prof. Thompson, and I would like Dr. Jamal Sayed, our director, Code M, to introduce Prof. Tom to our participants, to our viewers, please.
Thank you, Dr. Erum. We are honored to have Prof. Thomas Van Dyke with us in this session. I would like to introduce his profile is, mashallah, is too long, but I tried to make it cut short. Even then, it's very long. But I would like to uh, introduce all the things Mr. Prof. Thomas had done. Prof. Thomas Van Dyke is Senior Vice President for Clinical and Translational Research and is Senior Member of Staff at the Forsyth Institute in Cambridge, US. And he's also a Professor of Oral Medicine, Infection and Immunity at Harvard University of Faculty of Medicine. He's also a diplomat of American Board of Periodontology. He serves on numerous editorial boards of various journals and has edited 2 volumes of Periodontology 2000. He is president of International Association of Periodontology since from 1997 to 1999. Prof. Van Dyke has published more than 370 original articles, numerous abstracts, and book chapters. He is also a member of American International Association of Dental Research, IADR, American Academy of Periodontology, International Academy of Periodontology, and American Association for the Advancement of Science. Also, American Society of Microbiology, IADR, Periodontal Research Group, American Dental Association, and American Association of Immunologists. His research interests now are the structural and functional relationship of abnormalities of the inflammatory process, with focus on phagocytic cells and microorganisms in the etiology and pathogenesis of periodontal and other infectious inflammatory diseases. Dr. Van Dyke is also involved in clinical research, clinical trials focusing on drug treatment of periodontal disease and local delivery systems. Fine. So this is the brief introduction. I tried to make it concise, but it's a very long CV and profile of Dr. Prof. Van Dyke.
Thank you very
And
much.
I have taken the liberty from Prof. Van Dyke to call him Tom. So I'll be calling in between the sessions. Hello, Tom.
Hello.
Hi. Hi, Prof. How do you feel to join us, Prof?
It's a pleasure to be here. I'm very interested to see how the session goes.
Thank you very much. So let me just introduce our viewers that we are focusing today on interdisciplinary research and how the things move on from the basics. Since we floated the flyer has been posted, we received numerous questions and we have gathered them together from our viewers, and we will try to get maximum of the knowledge from Prof regarding whatever the queries we received. When many hands work in the same direction, and that too for achieving the same goal, success becomes a necessity. Helen Keller once said, alone we can do a little, together we can do so much. Same is true for dentistry. A variety of intricate connections exist between different biological tissues in oral cavity. The specialities dividing the oral tissues are only for academic convenience and growth of the subject. More so, the oral tissues and the oral cavity cannot be considered in isolation from the rest of the body. So, endodontists may need a periodontist consultation, and a periodontist may require orthodontic intervention, and so on. A reliable, successful treatment is often the outcome of collective interplay of the concerned specialties. The clinicians who preferred interdisciplinary approach have seen results worth noticing. Specialists with Varied acumen and expertise gather at one platform and work as a team to identify the problem, plan the treatment, and systematically operate it. Same applies for the research, that there, despite all advantages, there is still, we can feel that there is a gap in understanding of interdisciplinary research, where rather we have already switched into era of trans, multi, and interdisciplinary research. So we'll come directly to the questions, Prof. The first questions received from many of our students was that what is dental research and how can a dental researcher can work as a team with researchers in other disciplines?
Okay, well, dental research is research, okay? It's just applied to dentistry. But if we define research broadly, it's basically investigation of questions that don't have current answers, okay, using the scientific method, all right? So the goal of research is to identify a problem, figure out how to answer the question, and then test it in some experiment. Now, an experiment can be in the laboratory, working with DNA, all the way up to cells and tissues and animals and humans. Okay, probably the final application of research is the randomized controlled clinical trial, where you're actually testing whatever you've discovered in humans to see if it actually does what you think it's going to do.
Yeah.
Probably the biggest word that we have to worry about in research is controls. A control means that you're comparing your new experiment to something that exists.
Yes.
Okay, so you have a point of reference.
Exactly.
So if we just look at the literature as an example, if somebody gives publishes a case report, okay, that's an uncontrolled study. In other words, they said, okay, so I had this patient, this is what I did, and this is what happened. Okay, but that's very nice, but in terms of research, it's not very powerful. All it can do is suggest that there may be an association between what he did and the outcome, because without a control, in other words, the standard of care before, you don't know if what was done was better or worse or the same, okay. But, I bring that up because this is a common problem, particularly when people start out in research, is they don't ask the question about controls, and you always have to have controls. Now, how you get together with researchers in other disciplines, of course, is based on the question. Okay, so if you're interested in the relationship between periodontal disease and cardiovascular disease, for instance. So, I mean, that's been a hot topic for years. You have to meet people, talk with other scientists, go to the literature, figure out what's there now, and then figure out what the unanswered questions are. And then if this requires doing something in cardiac patients or or it could be anything, going back to the laboratory, saying, okay, so does this molecule that's associated with periodontitis impact cardiovascular disease or cardiovascular cells? I'm making this stuff up as I go along. Okay, so, but you get it's more or less an example. And then if you have the wherewithal to do the experiment, you don't need a partner, but if you're dealing in cardiology, where we don't have a lot of expertise, you may want a cardiologist to work with you to guide you through the cardiovascular side of the question. You can handle the dental side of the question. And so, that's how you establish collaborations. But, it's an outreach. You have to go knocking on doors and see if you can find a cardiologist who's interested.
Perfect. Okay, so that's very well explained. The next question, which was very common and it came from multiple people, was that most of us, we do surveys or questionnaires and sometimes clinical case studies. Very few here in Pakistan, they do the original research. How can we guide the researchers interested to do original research related to
Yeah.
clinical studies, especially? This is one of the question that comes like repeatedly.
Okay, well, surveys and questionnaires, if properly administered, is research. Okay,
Yeah.
so, but I think the basis of the question is original research. What is original research? And it goes back to what I said a minute ago. You have to, what's the question? Okay, you have to identify a question. So if your question is, soft, meaning, how do you feel about this procedure versus that procedure? Then get patient opinions and do questionnaires and things like that. If it's a hard question, meaning requiring hard data with specific measurements
Yeah.
that are quantitative, that you can have continuous variables, meaning that you're measuring something in millimeters or something like
So
that.
what I got from your reply, Prof, is that even if we are doing surveys and questionnaires, if we design it in such a way that the information is novel in its kind, it could be, it is an original research, right?
Yeah, exactly. Okay, but the other thing is what is original research? But in dentistry, we think so what's research in dentistry? All right, well, it's huge. I mean, it's a huge field when you think about it. Okay, there's dental materials. We use dental materials constantly. We're constantly looking for better dental materials, restorative
Yes.
materials, surgical materials, and etc.
Mhm.
There's biological research. Why do people get tooth decay? That's microbiology. Okay, why do they get periodontal disease? That's immunology and microbiology.
Yes.
And then you have the whole field of the practice of dentistry. I mean, who needs treatment? It's an
Yeah.
epidemiology question. There's healthcare disparities. Why do people get treatment and other people don't get treatment?
Yes.
These are
Viewers,
questions.
just focus on how Prof is saying that this is a very picky reply, definitely, that you can connect epidemiology, you can connect perio, you can connect material sciences, everything under one questionnaire, under one survey. Exactly, Prof?
You can. It'd be difficult, okay,
Yeah.
but you
Yeah.
can do it.
Yes.
And but beyond surveys, you can do clinical trials or clinical studies.
Yeah.
You can ask questions related to the benefits of treatment, for instance, treatment outcomes. If I do a free gingival graft versus a connective tissue graft, which one gives me better root coverage?
Yeah.
Right. So, I mean, it's a head-to-head clinical trial. It has to be very, very carefully executed. And, just saying that, it says, oh, that's so simple, I'll just do that. It's not so simple. You have to standardize who's doing the measurements. You have to have specific criteria for what you're measuring.
We have designer correct protocol.
This is all in design and data collection and stuff, so that at the end, that everything in every case was done exactly the same way. So the only difference between the two groups was the procedure itself, whether it's free gingival graft or a connective tissue graft. This is just an example. So, the challenge of doing research is precision.
Yeah.
Okay. It's not just designing the trial. It's making sure that so in statistics, I think everybody's probably taken biostatistics by this time in their career, and you have independent variables and dependent variables. Okay, so the independent variable is your outcome. This is, root coverage. Okay, but root coverage is your independent variable. The dependent variables are all the things that can impact that. And those are the things you have to control for. In other words, if you hold the probe, at a different angle, you're going to get a different answer. So everybody has to hold the probe at the exact same place on the tooth in the exact same angle. Okay.
So this depends on the training of the
these,
operators who are doing the research.
yeah, I mean, so these sound like silly, simple things, but they're not.
They have a
If
major
you look at
impact.
the literature, there's a lot of studies that are either misleading or not very well done, and have limited benefit because you really can't interpret the data. If the radiographs aren't standardized, okay, there's all kinds of issues that go along with this. It's arguable that clinical research is actually very, very much harder to do than bench research. Okay, because the bench is a very controlled environment. Number one, you're not dealing with people who are a problem all the time. Okay, they never tell you do what you tell them to do, and then you have all these other variables that you have to control for, and everything is very different. This is very different than doing a mouse experiment where you have congenic strains of mice. They all have the exact same genetic background. So you've taken out inter-individual variability from your experiment. Okay, so it's complicated, but there is no, as long as it's well done, the level of sophistication of research. So a questionnaire, there's nothing wrong with a questionnaire, as long as the questionnaire is validated, and you know that you're going to get a reasonable answer that reflects what you're measuring.
Exactly. So I think I will straight away switch to the question, which says many people ask that how can researchers refine their methodology before starting up any project?
Well, that's okay. The reason I'm laughing is because when you're planning a grant or a study, okay, I do this with my graduate students and my postdocs as well. You can spend a year getting ready, and then it takes a week to do the experiment, right? So what does getting ready mean? It means just what we were talking about. You have to, if you're going to do a clinical study, you have to standardize your outcome measures. You have to make sure that there's no examiner drift, for instance. That's a term that you'll see in the literature. But basically, the way you do that is you take a patient and you have the examiner make their measurements on this patient on Monday, Wednesday, and Friday, or on Monday 3 weeks running, so they can't remember what they said last time, right? And then you compare and see how accurate they are. Okay, so if on Monday you say the pocket's 4 millimeters, and on Tuesday it's 6, and on Wednesday it's 7, that's not very reproducible, right? But you'd be surprised at how difficult that is. It's even more difficult when you get into subjective evaluations like gingival index or plaque index and things like that, which we see in literature all the time. But if you have people do that repeatedly over a couple of days, if you have them do that twice, we often make those measurements twice in a study at the same time. You start in the upper right, you go around the mouth, you record all the values, and then you do it again. Okay. And the reason you do that is that very often there's variance between the two. Okay, so it increases your reliability for the precision of the measurements. So getting ready is where you sit down and you think of everything that you need to do, everything you need to measure, everything you need to control for. Then you need to standardize your examiners. You have to standardize your inclusion criteria and exclusion criteria if it's a clinical trial. There are just every dependent variable that you can think of that you can control for just makes it a much tighter study, and much more likely that what you're measuring as your independent variable is really what you think you're measuring. Okay, so preparation is 99% of the game, and then like I said, you do the experiment and then it's done. Then you have to analyze it, okay, which is another
Right.
thing to talk about sometime.
Would you say, do you suggest running a pilot is always good?
It depends on if you're, well, basically in any study, whether it's a bench study or a clinical study with people in it or mice or whatever, okay? Pilot studies are basically to, number one, train yourself to do these things, okay, and get estimates of your accuracy. But they're also very, very necessary if you're for statistical analysis. Okay, so if you're making a measure that's not in the literature, you have no idea what the variance to that measure is in a real trial. So you can't really do, a power calculation is based upon variance, right? So if your variance is large, you need a larger study group in order to find differences, right? So you'll do a pilot study. So I mean, if you're measuring probing pocket depth, okay, and changes in probing pocket depth after periodontal surgery, well, there's 60 years of literature for you to get variance estimates from. So you can just go to the literature and see what the most common variance is, and you can make a guess, do a power calculation as to what size study you need. But if you're measuring something that nobody's ever measured before, you do a pilot study with several patients, and it doesn't have to be adequately powered. You may not see a difference statistically in your smaller study, but what it'll tell you is what the variance is. So if the variance is 5%, then you can do the power calculation and say, okay, I need 35 patients, not 20. If there's 20, my type 2 error is going to be,
it's going to be
50%, and it's going to be useless. Okay, so that's the major reason to do pilot studies.
Okay.
So you don't have to always do them. You do them when you need information.
Okay. Majority of the dental graduates lack research lab facilities and trainings in vitro research in Pakistan. However, they are practicing as general dentists. So what are the possibilities and methods of conducting original research for general practitioners?
It would likely be in the clinical research realm. Okay, you see people in your practices, and their practice-based research, if done well, is again essentially the purest form of research. Okay, there are a lot of procedures that we do in dentistry that are driven by the marketplace, not by science. And so if you're interested in probably all right, so I'm going to go to medicine for an example of this, okay? Somebody once, one of the treatments for breast cancer some years back was bone marrow transplants. And somebody had hypothesized that in addition to the surgical procedures you did on the patient for breast cancer, you would also ablate their bone marrow and do a bone marrow transplant. Now, the logic behind this was that there was a very high incidence of recurrence in breast cancer and metastases. And the idea was that if you did a bone marrow transplant, you would kill all the cancer cells that were hiding in the body. Okay, the idea was they were hiding in the bone marrow. Okay, so in practices, once this was being done, now of course this is not a real procedure. I mean, a lot of people died from the bone marrow transplant, not from the breast cancer. Okay.
Yep.
Anyway, the long and short of it is that somebody finally did a practice-based research project where they looked at survival rates of women who had breast cancer, and half the group had bone marrow transplants and the other group didn't have bone marrow transplants. And what it showed was that there was absolutely no difference between survival. tell you. It tells you why in the world would you put a patient at risk and through the misery of a bone marrow transplant when it has absolutely no benefit, regardless of what the the theory was. Okay, so in practice it didn't work. So we have issues like that. Probably the one in the forefront today is an implant versus a root canal. Okay, so one can do either a prospective or a retrospective study and look at the survival of teeth that were treated with root canals, posts and cores and crowns versus being extracted and replaced by an implant with a crown. On the surface, the implant companies will tell you, well, this is obviously much better. You have osseointegration. There's no risk of fracture, blah, blah, blah. But the fact is that, is that implant not diseased 5 years from now?
Yeah.
Okay. Not is it still in the mouth? Because this is the other thing that we see with implant studies is whether or not the implant is still in the mouth is the criteria for success. Now, this thing could have one thread left in bone and be hugely infected and causing more problems than it's solving, but it's still in the mouth, therefore it's still successful. So you have to determine, and this is an issue of outcomes. Okay, is the implant successful if it's still in the mouth, or is it successful if it's still in the mouth and healthy?
Yeah.
So to answer the question, you need to identify issues in your practice, and if you really want to do some useful research, you identify a question that says, okay, we do this procedure, but if you go to the literature, there's absolutely no data to show that this procedure is better than the old procedure, only that it's 10 times more expensive. Right? So if you run a parallel trial, and again, you can do this retrospectively. You can say, all right, I've been practicing this way for 10 years, and half my patients I did X, and half my patients I did Y. Now I'm going to go back and look at the last, from the time I did the procedure till the last visit, and see how many of these people have success with one or the other treatment.
Yes.
Now you have to define success. You have to describe how you're going to measure success, all these other things. But these are the kinds of questions that can be easily, not easily, but adapted to clinical practice for people in general practice.
I think you have already answered the next question as well, because the next question says, how can a researcher be less dependent on laboratory-based research if they can't get access to lab equipment and at the same time can do quality research work in their country? So Prof has already answered this question very nicely.
And then the other area is epidemiology. Epidemiology, determining treatment needs, determining prevalence of disease, determining healthcare disparities between populations. All of these things don't require a laboratory. All they require is somebody to come up with good measures.
Good measures.
And compile the data.
Right. Okay. Then there is a question, what should be the main considerations while designing a research project? That's also answered by Prof. I think, regarding the precision of methodology. Is there anything you want to add in this question, Prof?
What number question is that one?
What should be the main consideration, number 5, what should be the main considerations while designing a research project?
Well, I think we've touched on all of those, because the main consideration is that what you're measuring reflects what you think it does. Okay.
So we are left with the last 10 minutes of our session. We'll quickly go through the rest of as much as we can. The next question says, are there any opportunities for researchers abroad to go and work in research labs part-time for their own research projects where they don't have to pay or have to pay a little charge and do their laboratory-based projects?
Well, they don't have to pay. I mean, there are programs for postdoc postdoctoral programs. So, if you're a dentist, you're a doctor. Okay. So you can do a postdoctoral research program.
Mhm.
Um, in a postdoctoral situation,
Mhm.
um, you're basically going to learn research methodology from a professor somewhere.
Mhm.
Okay. And finding that professor and working in their laboratory. Um, I mean, postdoctoral positions are sometimes paid.
Mhm.
Sometimes you can do them with, on a volunteer basis, where
Mhm.
you're not paying for anything. The professor has to support the research. Okay,
Mhm.
so you have to find somebody with a grant and funding who's willing to support, um, you as a postdoc.
Mhm.
Um,
Prof, I'll
and
just interrupt you here a little bit. For applying to a postdoc position, is there any minimal criteria to apply? Like most of
um,
them, we have an assumption that we need a PhD to apply for a postdoc. Is it true?
no, I mean, for instance, there's a program. The NIH has a program, a training program,
Mhm.
where international people can come to the States and do a postdoc. It's restricted. You have to be a dentist in order to do this. It's funded through the National
Okay,
Institute
fine.
of Dental and
That's great.
Craniomaxillary Research.
Mhm.
And, having zero research experience, it's very hard to get those positions.
Mhm.
Okay.
Mhm.
But if you've had some research experience, albeit at your home university, doing epidemiology or clinical research, or whatever you've done, and you want to learn some basic science skills, you can apply to these programs. The positions are very competitive and very limited, but they're
But there
certainly
are options.
there, and it's possible. Um,
Okay.
there are Fogarty fellowships. I'm thinking of the U.S. This leads into the questions about who can fund these kinds of things. The European Union is actually much more forward-looking in this regard in terms of uh, in developing countries, supporting
Mhm.
scientists to come to Europe to various universities to get training, where they provide the grants, and then they also provide grants to take back to the home country after the
Mm,
training.
Great.
So the EU has many of these. They're somewhat limited in the states. The states support people to come here to study in
This.
various ways in these postdoc kind of programs. There
Mhm.
are Fogarty fellowships, which is also a fellowship that you write with a U.S. investigator. But a lot of this is personal interactions. You have to find somebody to work with who
mm,
has the wherewithal to support somebody.
Mhm.
Um, and well, as somebody in that position, I get 10 requests a day. Okay,
Mhm.
to give you an idea. So there is demand
Mhm.
for
yeah.
this sort of thing.
Mhm.
But you know, this is when you let your fingers do the walking on Google.
Yeah.
Uh, and you look for fellowships. You just Google fellowships in dental research and see what comes up.
Mm,
Mhm.
fine.
And you'll find that there are some will lead you to the NIH, some will lead you to the EU,
Mm,
others, various parts of the world. You will see that this is possible.
Yeah.
So it takes a little legwork, and it takes a commitment. I mean, a lot
yeah.
of people don't do this kind of thing because of how disruptive it is.
Mhm.
I mean, if you're practicing dentistry in Pakistan, are you going to just close up your practice and go away for 2 years to learn something and then come back and try to start it again? I
Mhm.
mean, there are practical considerations for
Yeah.
doing this kind of thing. So,
I have done that.
Yeah, well, like I said, some people want to do that, but not everybody's in a position to do that,
Yeah.
or wants to make that kind of
It's
time commitment.
very difficult.
Yeah.
You know what,
Yeah.
Prof? We know people who want to do that, who are ready to do that, but they don't know how to do that. So you have given a very informative session where they would have
Yeah.
where they would have at least a hope that those who are willing to do, and everything
Yes.
all of us we do, except that all of us have to step out of our comfort zone if we
Yeah.
want to achieve something.
Hmm.
Success needs hardships, it needs traveling, it needs everything, and everyone is a self calculator. We have our own assessment, right? So
Yeah.
thank you very much for this wonderful session today, Prof. And we have lots of questions more, and I hope we will be conducting them regularly, and we will be asking for your time again for the people of Pakistan. Me, Dr. Erum Khan, and Dr. Jamal, on behalf of CODEM and the team CODEM and all the participants, we would like to thank you for your time, for your humbleness, for your knowledge.
Once again, honored to have you here.
Trust me, it's
Thank you very much. You're very kind.
are very happy to hear you. I'm getting messages on WhatsApp continuously, and we are going to have another session soon, and we will be reporting their queries later on. Okay.
Okay, very
Thanks,
good.
bro. Thanks, Tom.
Thanks.
You're welcome, Jamal. Thank you,
Thank
Ron.
you very much. Thank you
You're
very much
welcome.
for your time. See you again in another session soon. Till then, stay
Yeah.
tuned and learn a lot. Goodbye.
Okay, thank you. Bye-bye.
Bye bye.
Bye bye.